A Long Island father has an urgent message for parents after his son came down with a rare but serious complication associated with coronavirus.
And doctors worry with a spike in COVID cases, we could see more sick kids. The family speaking exclusively with CBS 2's Jenna DeAngelis from Cohen Children's Medical Center.
Say hello, mijo.
Hi. Hi, Andy.
Hi. 7-year-old Anderson Pilko has been in this hospital bed since Christmas, and his father, Carlos, hasn't left his side.
I told him that I will be with him because I have to take him back home. He's my heart. It's just my heart, and I think every parent will feel the same way for their children.
Which is why he's sharing his story to help other parents look out for multisystem inflammatory syndrome in children, or MISC, a condition which can cause inflammation in organs. It landed Anderson in Cohen Children's Medical Center, intubated for several days.
Seeing him in the bed like that, it was tough. It was at one point that I felt that I was losing him.
It all started with abdominal pain, vomiting, and a fever, which Chief of Pediatric Critical Care Medicine Dr. James Schneider says are classic symptoms of MISC. Others include rash, bloodshot eyes, and exhaustion.
It's a condition that seems to be a reaction to a previous COVID-19 infection that usually occurs about 2 to 4 weeks prior to the presentation of MISC.
Anderson's father says despite extreme caution, he and other family members contracted COVID in November. Anderson got MISC about a month later. According to the latest CDC data from December 4th, there have been more than 1,200 cases nationwide and 23 deaths since it emerged in the spring.
Now the fear is that, as we're expecting, we've seen a huge up spike of acute infections, both in kids and, of course, in adults we're well aware of. We're expecting to see more and more MISC.
Cases are slowly trickling into this hospital, like Anderson, who after treatment is breathing on his own.
Good. You feel good?
Right now. Dr. Schneider says while this is very dangerous, it is treatable, which is why it's important to seek medical care immediately. He urges people continue wearing masks and social distancing. At Cohen Children's Medical Center, Jenna DeAngelis, CBS 2 News.
We're pulling for that little guy to continue to get better. The CDC says the average age of kids who have had this is 8 years old.